The following short video demonstrates proper aseptic technique to reconstitute a drug powder for injection. Before entering the hood, perform all necessary calculations and have them ready. Do not bring any papers into the hood. Follow proper garbing procedure to ensure appropriate aseptic technique is performed. The materials required include an alcohol swab, the correct size syringe and needle, the correct type and volume of diluent vial, the correct drug powder vial, the correct volume and type of minibag solution, a seal, and a filter needle if required. Set up supplies in the hood from left to right to minimize airflow disturbance. Ensure that all critical areas that require first air are facing open airflow. Remove the plastic caps off the diluent vial and the drug vial. Place all trash to one side as to not block airflow. Disinfect the rubber vial tops with the alcohol swab as well as the minibag injection port. You may keep the alcohol swab under the injection port if you choose, although it is not necessary. Unwrap the syringe and place all wrappers to one side to minimize first air disruption. Hold the syringe anywhere on the barrel with one hand, keeping in mind not to block air to the luer lock. Unwrap the needle with the other hand and assemble the hub to the luer lock tip by twisting either the needle or the syringe in the appropriate direction. Remove the needle cap by pulling the cap and the barrel in opposite directions. Lay cap inside laminar hood with the opening facing the back wall where first air circulates. Draw volume of air into the syringe equal to the diluent volume because vials are closed system containers. You may push on the lip of the syringe first before you draw air if it is hard to pull the lip. To correctly read a syringe, the final edge of the plunger piston must be lined up to the desired calibration mark on the barrel. The non-coring method of needle insertion. Anchor bevel tip of needle to the diluent vial stopper at a 40-degree angle with the bevel side up. When the bevel heel lines up with the bevel tip, pierce the stopper with the bevel tip first and then press downward and toward the bevel as the needle is inserted. How to hold the system. With your hands palm facing up, use your index and middle fingers to hold the diluent vial and your thumb and two other fingers on the syringe barrel to flip the assembled system clockwise as to not block first air to the luer lock tip syringe connection or extended plunger. Inject air slowly by pushing on the plunger. This may be done at once if the volume was small or slowly if the volume was large. Pull down on the lip with your dominant hand's thumb to a volume more but close to the volume required. Remember, do not block first air anywhere on the extended plunger and do not touch the plunger. Removing air bubbles. Firmly tap the barrel with fingers or knuckles so that air bubbles clinging to the side are freed and float to the top of the syringe. Expel all the air in the syringe by slowly pushing up the plunger until the solution fully primes the attached needle. To correctly withdraw the needle, flip the assembly counterclockwise downward and set it on the surface while still holding it. Remove the needle. Drug powder reconstitution. Perform correct needle insertion to avoid coring fragments out of the rubber stopper. While the drug vial is set down, inject fluid into the vial slowly for reconstitution. An equal volume of air must then be removed to prevent positive pressure from developing inside the vial. Keep the vial down when air is removed. Remove the syringe, but don't set it down yet. Dissolution. Shake or swirl the drug powder vial to ensure complete dissolution. Be sure to keep the top of the vial open to the first air. How to draw up the reconstituted drug dose. Draw air into the syringe to the desired volume of the reconstituted drug to be administered for one dose. Inject air into the drug vial and withdraw the dose. Pull up the drug vial so the needle is not exposed to the air in the vial. Remove air bubbles. How to inject one dose. Hold the minibag with your non-dominant hand, and while holding the syringe by the barrel in your dominant hand, insert the needle into the minibag and inject the drug. Remember, do not block first air to the extended plunger. Disposing of the needle and syringe. Discard syringe and needle in the sharps container. It is not necessary to recap the needle if the sharps container is in close proximity. If the needle is to be recapped, use the scoop method to avoid any finger sticks. Mixing and inspecting the minibag. Mix the drug in the minibag and inspect for any particles or discoloration through the non-writing side. Sealing the minibag for tampering purposes. Peel the seal wrapper and place the non-sticky portion on the injection port. Press firmly.